Yeah?
Sorry, so before Min begins, so the order is you are doing first and then you is it? Yeah. So after you three finish, then you just move behind and move forward. Okay. There will be no Mandarin sound bites today. So for now, we will start with one question per person, as I stated earlier. And bubble timing is at the end of the Doorstop interview. So not at the end of the opening remarks, but the entire Doorstop interview. Then I'll tell you what time.
Okay, you're ready? All right, I say a few words first, then you can take questions later. Singaporeans have expressed concerns about the recent rise in cases. And as we explained, sorry?
You look at her?
Oh, I don't look at camera? I look at her? Okay, all right. Okay, sorry, restart. Singaporeans have expressed concerns about the rise in cases recently. And as we explained last Friday, this was not unexpected. We knew that there would be more cases once we open up and resume activities. What is of concern to us is not just the absolute number of cases, but the rate at which the virus is spreading. And that's the reproduction rate, or R. Currently, the R is more than 1. Cases are doubling every week. And if we continue on this trajectory of infection, it means we could have 1,000 cases in 2 weeks or possibly 2,000 cases in a month. And we know from the experience of other countries that when cases rise so sharply, there will be many more ICU cases and also people succumbing to the virus. It's not just the unvaccinated seniors, because even for vaccinated persons, there will be a small proportion of them falling severely ill. And if you have a very high infection caseload, that small proportion will translate to a sizable number of ICU cases and eventually fatalities. So we have to slow down the transmission rate and bring R down. We will attempt to do so without going back to another heightened alert. And in particular, we will go for aggressive contact tracing and ring fencing of cases and clusters and push for more pervasive testing. So in particular, we will do several things. One, we will increase the frequency of testing for workers in high-risk sectors. We will increase the frequency from once a fortnight to once a week. Second, we will expand the coverage of the mandatory tests to other areas, including workers in retail, malls, and supermarkets, as well as delivery personnel and transport workers. And thirdly, beyond the mandated settings, we will distribute antigen rapid test kits to all companies so that they can administer weekly tests for their staff, particularly their on-site staff, over the next 2 months. So with all of these measures, we will try to slow down the transmission and buy ourselves time. Buy time to firstly get more seniors vaccinated. And we are making good progress on that front. We have already brought down the number of unvaccinated seniors aged 60 and above to 94,000. And the numbers will continue to go down because every day we are getting about 500 seniors coming forward for vaccinations. Second, we will buy time to roll out our booster program for those aged 60 and above, which we announced recently. And the invites, the first batch of invites for these seniors to get their boosters will be issued in 2 weeks' time. We are also studying the possibility of boosters for younger adults. And this will not only protect them, but also help to slow down transmission and further reduce the R. So with all of these measures, we hope that we can help to slow down transmission without having to go back to the heightened alert or the circuit breaker. As I said last week, these are last resort measures that we will try our best to refrain from using them. But we should not rule them out entirely. And if, despite our best efforts, we continue to see, or we see serious cases in ICU or needing oxygen going up sharply, then we may have no choice but to adopt a more tightened posture. So we really need everyone's cooperation to help to bring down our transmission rates and bring our R down. And that means getting everyone to be tested regularly. Everyone should make this a new norm, regular testing. We need everyone to cooperate with the SMMs and exercise social responsibility. And we are calling on everyone to also scale back your non-essential social activities during this period. And I think if we all work together and continue to cooperate with one another, we will be able to manage our risk and reopen safely. Questions?
Yeah, thanks for the remarks, Minister. So I have a question about why these announcements are being made now instead of Friday. Was there anything that happened, particularly in clusters over the weekend? And if the situation is getting serious, why is there a wait for some measures to kick in and not?
Sure. Well, the fact is we were already thinking about some of these things on Friday. We talked about making testing more pervasive, but there were obviously details that needed to be worked out, so we were not able to announce them on Friday. And also the situation obviously is very fluid. Every day you are continuing to see new data, new clusters or new cases. And so as we entered Friday, we were already considering that very carefully, more pervasive testing. But then as we saw the additional data unfolding over the next few days, and as we worked out the testing procedures, we decided that we had to move faster to put in place these additional protocols, which we are now announcing today. If the reproduction rate is increasing at this level, I mean, every week is doubling. So we are talking about that kind of exponential increase, which means that, each day you have to, learn something new and move as fast as you can.
Okay. Minister, question on the social gathering. So now we are asking people to limit their social gathering to 1 per day. Why not instead of cutting from 5 to 2 per day?
Sure. So a cutback of 5 to 2 or even 2 to 0 would essentially mean going back to a heightened alert. It means adopting a generally more tightened posture. As I said, we are trying to refrain from doing so, and we are calling on everyone to do their part, exercise social responsibility, and in that spirit, we are asking people, scale back your non-essential social interactions. You don't have to have the mindset that you are maximizing to the limit your ability to go out, right? Because yes, you can go out to dine, but scale back during this period because every effort counts. And if all of us do our part by getting tested regularly, by scaling back interactions, we will be able to slow down the transmission.
Thanks, Minister. I'd like to ask about the difference between the health risk warnings and the health risk alerts. What is the threshold for someone to get HRA and someone to get a HRW?
So there are multiple rings in our contact tracing approach. We have explained that before. The most highest risk are the close contacts, which will be issued quarantine orders. This means you have been in a close contact with that infected case, we have been identified, and quarantine order issued. Beyond that close contact, we have 2 other rings. The next bound will be the health risk warning, and that would be beyond the close contacts, but we think there is some risk of exposure. There are some thresholds which the professionals use. They can elaborate further, but that wider ring will be issued a health risk warning, and it means it's required of that person to step forward for a test. You have to be isolated before you get a negative test, and then over the next 14 days, you do your DIY antigen test kits, and then a negative test on day 14. So that's a requirement, right? Then the most outermost ring is where we are just casting the widest possible net. Let's say you are in a mall at the same time as we saw a cluster, and you may not even have any interactions with that infected person, but potentially you will at the same time based on your safe entry data. And then in that very, very wide ring, we will issue a health risk alert just to notify you and ask you to take the necessary precautions. So those are the multiple rings which we have already put in place, but we will cast that net wider which means that more people will potentially get alerts, either a health risk warning or a health risk alert. And we again seek everyone's cooperation. When you get one of these, please do your part and take all the necessary measures seriously.
My question is with regards to HRW and HRA. How do we ensure individuals comply with the testing requirements? And could you give us some example of what it means to reduce social interaction? Does it involve, for example, not going to work if you're able to work from home?
So on the health risk warning, we will be able to enforce that because we know who that person is, and that person is required to come forward for the PCR test. And even when they do the subsequent, after the first PCR, they have to administer the test, the ART in between, and we will ask them to report and show, right? So there will be monitoring of the testing done for HRW. For HRA, it's really, it's not mandated to begin with, so it's really more on a encouragement, and we strongly encourage everyone who gets a health risk alert to take the necessary precautions, which means minimize your activities. But if you are not feeling well, then immediately you know there's a sign that something may be not right. Even if you're feeling under the weather, then quickly see a doctor. Or, we are giving out test kits now to every home, so they should be able to use the test kits also on themselves at home. So it's just to raise the consciousness and make people more aware. So that's on the first question. On the second question, what was it? What does it mean to... Well, we are, again, this is not enforceable, right? So it's an encouragement to everyone, scale back non-essential, and we say one contact per day. So imagine if somebody says, look, now it's five persons rule, all vaccinated. I can go out for breakfast, lunch, dinner, and I can have, I can even do a house visit after dinner. I can have multiple contacts. Yes, it's permitted under the rules. But I think the more we circulate, the more we are out and about, there is always a chance that we, by circulating around so much, may inadvertently become the source of the next super spreader event. And we are trying to ask people, please hold back, particularly during this period where there are so many cases and where the virus is spreading so quickly. Just scale back, cut back your social interactions, if possible. Go out if you need to, but if they are non-essential activities, scale back, exercise some restraint and moderation. For work from home, that continues. We have already provided the guidelines that 50% of staff who can work from home can now go back to the office. So that remains. We are not changing that guideline, but we are asking all employers to test regularly the staff who are working on-site. And as I said, we are going to distribute ART test kits to employers so that they can administer these weekly tests for their staff who are working on-site in order to ensure that their workplaces remain safe.
Minister, with this spike in number of cases and the appearance of big clusters recently, how will this strengthening of public health actions have an impact on our vaccinated travel lanes with Germany and Brunei that will commence in two more days?
We are continuing to, with all the announced activities and the programs and pilots and the vaccinated travel lanes that we have announced, we are continuing. So we are not stopping any of the things that have been announced. We are not going back to a heightened alert. We are not tightening up restrictions. We are not doing that. What we are trying to do, as I said, is to try our best to refrain from having to adopt a tightened posture, but still be able to slow down transmission as much as we can through more aggressive contact tracing, more widespread testing, and finally, by everyone doing their part and exercising social responsibility. So it's a reflection of our new phase, that we have a much higher level of vaccine coverage and protection, and therefore we don't have to go back to the heightened alert or tightened posture restrictions, but we can hopefully slow down transmission with all of these measures. But as I said, if despite our best efforts, we find that the number of serious cases needing oxygen and ICU care goes up sharply, then we may have no choice but to tighten our overall posture. So we should not rule that out.
Thanks, Mr. Wong. I have a question about the booster shots. So I understand that Singapore has been donating some of our vaccines to other countries, such as Australia. And considering that booster shots are looking necessary for vaccinated individuals, could these vaccines that were donated have been used to kickstart the booster program earlier in Singapore, or have been administered to other demographics of Singapore?
Sure. The swabs that we have engaged in do not in any way delay the timing of our booster program. Not at all. We have enough vaccines to roll out the booster program for those who need them based on the timeline that the expert committee had recommended. They said 6 to 9 months after you complete it, and on that basis, we will be issuing our first batch of invites to the seniors in 2 weeks' time. And we will have more than enough vaccines to administer to those who are eligible. In fact, as Minister Ong said at the last press conference, the swabs will be advantageous for us because the number of people who need the boosters will progressively go up. Who are eligible for the boosters will progressively rise over time. Because remember, not everyone took the primary vaccines in February or March. It was a progressive schedule and it rose more in March, April. And so our booster demand will correspondingly rise in the next few months. And when that happens, we swap now, we get back later, we will have enough vaccines when the demand for booster goes up in the following months. So, in fact, the swaps do not in any way impact on our booster program at all.
Thank you, Minister. So I'd like to ask, with the exponentially growing number of cases, has our original timeline for reopening been set back in any way? And if so, what is the new timeline? Thank you.
So even when we embarked on our reopening plans, we were very clear that we would do this in a controlled manner, always looking at the number of severe illnesses, because we said our focus will shift beyond, moving beyond just the headline numbers, but looking at the number of severe illness and the number of cases needing oxygen and ICU care. For now, as I said, this remains stable. It remains under control, but we are concerned because we see that acceleration in our infection rates, and with any sharp rise or sharp spike in overall cases, the experience in other countries has shown that the number of ICU cases will naturally follow. And that's why we are redoubling our efforts on testing, and we have said we are not planning on any new opening moves at this stage. But that was always the plan. I mean, we didn't want to constrain ourselves with any particular timeline, even in the original reopening plans, because we knew this was likely to happen. We will see wave after wave of cases, and as we take some steps to open, we will continually see wave after wave of clusters, and with each wave, we have to monitor the consequences, monitor the outcomes, make sure that our hospital system is not overwhelmed before we take the next step forward.
Hi, Mr. I have another question about, is there any protocol for places, for example, certain given like malls when cases break out, for example, the most recent Bugis Junction cluster, would it be asked to close? Is there any protocol in place?
Those are existing protocols. The healthcare professionals, public health experts looking at this, if they see that there is an active cluster in any particular location, then they may take beyond a certain threshold, beyond the close contacts and quarantine, and beyond the HRWs and the HRAs that are going to be issued, they will consider taking actions to close that particular site. It could be a work site, it could be a mall, it could be a market or hawker center. We have done that continuously over throughout the year, and that posture remains.
So could I ask, what is that threshold?
I don't have the exact technical threshold, but they obviously will look at the number of cases, how extensive the cluster is, and then they will take the necessary actions. Yeah, any more questions?
Could I ask one more then?
Yes, of course.
With regards to the FET testing,
Yes.
I understand that it's going to be possibly extended to more community settings as well. And when would we expect
You mean, so the mandatory test, as I said, now it's for F&B, gyms, and all these high-risk settings that you're familiar with. We will increase the frequency from 13 September, once a fortnight to once a week. For the expansion of these mandatory tests to other settings, I mentioned a few just now, mall, retail staff, supermarket, delivery, transport. The agencies are working on a timeline, so it's not going to be 13th September. That would be a little too fast, but they are working on a timeline to get these companies onboarded, and then eventually they will be put on the mandatory regime. So the agencies will give more details in due course, but they do need a little bit more time to onboard the companies and workers.
Is there any plans to distribute ART kits to schools as well, instead of just employees?
Yes, we are looking at what we can do for more regular tests across the entire school setting too. So that's a work in progress. We are looking at ways in which we can get, it's really the method of testing, especially for children. I think if you are in your teens and older, university, higher institutions of higher learning, not such a problem. But for children, there is an issue of, well, even for the ART kits where the no swab doesn't go all the way in, but for young children, are they able to do it properly? And how to administer these tests. So we are also studying whether there are other methods of sample collection that can be convenient and accessible, and that would be suitable for both preschools and children in primary schools. So that's something that we are working on quite actively, and we hope to have a solution quite soon.
Minister, may I check, because now we are encouraging people to do self-testing. So last week actually you announced that they can go to the quick testing center.
Yes.
But because it's self-paid, so do we roughly know how much is the cost? Because a lot of Singaporeans actually concerned.
Of the quick test center, I don't know how much they are charging, but the cost of a test kit is, you can get it at $10 or I think thereabouts in a pharmacy. And I think it's worth, we have given out some test kits. People can do it themselves. But if they want to do it at a quick test center, we are opening up our test centers for them to do so. And beyond the test centers, last week on Friday, we said we are planning to expand the number of sites all around the island so that it will be much easier and faster for people who need to get tested. Beyond doing it at home, which you can, and then there are ways in which you can monitor these self-tests at home. You can do a video, you can show to the employer. So these are supervised self-swabs, right? But beyond that, we intend to make testing at these test centers, test sites more accessible and convenient. And so we are also working on something to expand the number of quick test centers, and we will put out details when we are ready.
So the cost can be roughly similar to the ART?
I would imagine so. I don't have the details now. MOH probably will be able to provide those details.
For HRW and HRA, will the test be subsidized if people receive this alert?
As of now, the current regime continues. I can't remember whether we are giving it free or whether we are charging. I can't, but that's a detail that MOH can advise. But we are operating on the current basis. This is not new. HRA and HRW is continuing, but what we are planning to do is expand the circle, and potentially many more people will be issued these alerts. It's only the HRW, incidentally. HRA, there's no mandatory test, but HRW comes with mandatory test. Okay? All right. Thank you very much.
Thank you.